Uterine polyps are one of those annoying things that you don't think you need to know anything about it until you're told you have one. I am your local OBGYN. I love women, and let's talk about it. So, frequently I will have somebody come in and there can be a variety of complaints. It could be abnormal bleeding, bleeding between their cycles, postmenopausal bleeding, or a woman who's having some difficulty with fertility, and an ultrasound or a HSG, where we kind of put fluid back in the uterus, can show us the contour of what looks like a polyp, which is an overgrowth of the lining of your uterus. So when the endometrial lining overgrows, you kind of get this like tongue-like projection that pushes inside the uterine lining and can make the bleeding funny. Some women get symptoms, some women don't. Sometimes this hanging thing can actually make fertility levels lower while it's there because it kind of like blocks or screws up how a pregnancy wants to implant. And if you're postmenopausal and you bleed, you have to worry, is there something abnormal in the polyp that could be precancerous or cancerous? So usually these women are recommended to get a D&C hysteroscopy. Some offices have setups where this can be done in the office under some sedation, or it can be done in an operating room where you're kind of like knocked out. The polyp gets scraped out, sent off. Either way, when you take it out, it should go to a lab for testing because there's a small chance of malignancy in most women, but in postmenopausal women, especially with postmenopausal bleeding, that risk is a little bit higher. And if there's something bad there, we want to know about it as soon as possible. Fast recovery, easy procedure.